Hello, in this video we will show you which babies can be put onto CPAP. This is through an algorithm called Try-CPAP. It is one of the 3 algorithms we use for determining which babies need CPAP and how much treatment they should receive. The algorithms are designed for use by clinical staff, but they cannot account for every case. Experienced clinicians may decide to alter treatments on a case-by-case basis.
The Try-CPAP algorithm is designed to help you identify the babies that will benefit most from CPAP. But before you use it on a very sick newborn, make sure you do the ABC assessment first and carry out any emergency resuscitation that is needed. Only then assess for CPAP. To be eligible for CPAP, they must be breathing by themselves and have a heart rate greater than 100 beats per minute and weigh more than 1 kilo.
It is also possible that there will be occasions when an experienced neonatologist or pediatrician working in a well-staffed and equipped unit may decide to treat babies outside this weight range.
Next, you need to assess their tone. Babies with poor muscle tone will appear floppy and unable to move their limbs properly. Babies with poor tone should not be put on CPAP. If 15 minutes or more after birth their saturation level is below 90%, they should instead be placed on oxygen at 1 liter per minute. The next group will be the smaller babies who are breathing by themselves and have a heart rate greater than 100 beats per minute. Babies who weigh between 1 kilo and 1.5 kilos, or who are premature at 30 weeks or less, will benefit from CPAP even if their saturation is above 90%. They should go straight onto CPAP. The third group are babies who weigh more than 1.5 kilos with a heart rate greater than 100 beats per minute. You need to do some further assessment to see if they're eligible for CPAP. First, you ask, is their respiratory rate more than 60 breaths per minute? To count the respiratory rate, you need to time for a full minute. If you count more than 60 breaths, then start CPAP. Next, ask, is their saturation less than 90% when breathing in room air? Once again, if it is, then they should start CPAP. The final question is, do they have signs of increased work of breathing? So this is a baby with normal breathing. Now, this is a baby who is having to work much harder to breathe. The recessions between the ribs are very marked. And this baby has seesaw breathing. All these are signs of increased work of breathing or respiratory distress, so the babies also need CPAP.